Welcome to the Wellness Protocol, your source for guidance on metabolic health, hormones, and longevity. I'm Dr. Alessia Roehnelt, double board certified endocrinologist, and on each episode, I'll share simple tools rooted in science and experience to help you feel better, live longer, and take control of your health. Welcome back to the Wellness Protocol, your go-to podcast for holistic insights on hormones, metabolism, and longevity. I'm your host, Dr. Alessia Roehnelt, board-certified endocrinologist and advocate for evidence-based wellness. Today's episode is all about a topic that's literally everywhere, GLP-1 medications. You've probably heard the names Ozempic, Mounjaro, Wegovy, all of those in the news or on social media. But what exactly are these medications, and are they right for you? Today, we're deep diving into what these GLP-1 medications are, what they were invented for, their benefits, their risks, who can truly benefit from using them. And if you're curious about using these medications, considering them for yourself, you definitely want to stick around because we are going to break down the good, the bad, and the realistic. Now, don't forget to subscribe, leave your comments or questions, and share this episode because your feedback helps shape our future conversations and what you want to hear discussed. So let's get started. What are GLP-1 medications? Well, let's start with the basics. GLP-1 stands for glucagon-like peptide 1, and it's a hormone that is naturally produced in your body, especially in your gut. The hormone really plays a critical role in managing blood sugar levels as well as controlling hunger. Medications that mimic GLP-1 are those that I'm sure you've heard of. Most famous would probably be Ozempic, which is the brand name for a drug called semaglutide. There's also a version of semaglutide available strictly for weight loss. That one is called Wegovy. Mounjaro is another very popular medication used for diabetes. The drug name of that is tirzepatide. That one is also available in a weight loss form called Zepbound. And there are many others. These have actually been around for quite some time. So some of the earlier ones on the market that may have not gotten as much popularity would be medications like Trulicity, Saxenda, Victoza, Byetta, and Bydureon. The medications were initially developed to treat type 2 diabetes because they work in several ways to improve blood sugar. They help enhance insulin release, they also reduce appetite, and they slow digestion. This allows for more consistent blood sugars without very high blood sugar spikes after meals. The GLP-1 medications first appeared on the market years ago in the early 2000s. In 2005, the FDA approved the first GLP-1 medication, which was called Byetta. And it wasn't until later in 2010 that another medication called Victoza was approved to treat diabetes. Now, as these medications were coming out and were being used to treat patients with high blood sugar and diabetes, we were discovering things that we didn't quite expect. We were finding that patients would lose a significant amount of weight on these medications. We found that their appetite was suppressed. We found that they were getting full faster, and their overall intake of food was actually decreasing. Now, this happens with a lot of medications, actually. They are developed for one reason, but the longer they're around, the more we realize what they have the potential to do, and medications start to be used for other things. Now, in 2017, Ozempic, or semaglutide, was approved to treat type 2 diabetes. But the game changer, and really what took everything by storm, is in 2021 when semaglutide was approved specifically for weight loss under the brand name Wegovy. This was huge because this was the first time that the company was saying this is safe to use in people who do not have blood sugar issues, in people who do not have type 2 diabetes. You can give these to patients who are obese and they will help them lose weight. They do not have to have underlying blood sugar issues to benefit from this medicine. This started the significant shift towards addressing obesity, not just diabetes. So let's review a little bit more about how these medications actually work. GLP-1 medications do numerous things, and honestly, we're still finding out other mechanisms by which they work and help people feel better. What we do know is that they stimulate insulin release when your blood sugar is elevated. That will significantly help lower high blood sugars. The nice part about this is that if your blood sugar is not high, these medicines don't stimulate insulin release, which means they should not cause blood sugar to go too low. And that's why they are safe to use in people without blood sugar issues. Additionally, these medications suppress a hormone called glucagon. Glucagon is a hormone that actually raises your blood sugar when you're not eating anything. We certainly see the effects of glucagon on blood sugar when patients are waking up in the morning, when they haven't eaten anything all night, they've been fasting all night, and their blood sugar actually starts to rise. I have patients come in the office completely confused about this because they say, I wasn't eating anything, I was sleeping. How is it possible that I'm waking up in the morning with a higher blood sugar than when I went to bed? It's because of glucagon. When your body hasn't seen food or sugar in the bloodstream, glucagon causes your blood sugar to start rising when you're not eating anything. So these medications help to suppress glucagon secretion. Another way in which they work is that they slow gastric emptying time. What that means is normally when you eat something, it takes a certain amount of time for your stomach to process it, to digest it, to break it down, and for it to be released into your intestines. These GLP-1 medications slow down that process. That means that you feel fuller longer. It means you seem to have less of a blood sugar spike after a meal because things are processing more slowly. They also help to impact your brain directly. So they enhance the feelings of satiety, meaning you feel full, you don't feel like you need to eat anything. And they seem to also really reduce cravings. This is actually even seen in patients who have certain addictions, like smoking addictions or alcohol addictions. They're finding that these GLP-1 medications help so much with those craving centers in the brain, those addiction centers in the brain, that they're now being studied to help people reduce alcohol intake and reduce smoking. So when you are targeting appetite and blood sugar through multiple angles, through how long it's taking the stomach to empty, through how much insulin is secreted, through how much glucagon is secreted, through certain hormone receptors in the brain. You can see that there are many ways in which these medications not just help blood sugar, but can also help people lose weight. Many times I have patients come in saying to me, I don't eat that much, so I don't know how a medication that's going to suppress my appetite is going to help me lose weight. Or they say that, well, I've heard the only reason you lose weight is because you're so nauseous you can't eat anything. And those statements are not true because these medications really do work on many different areas of the body to aid in the weight loss process. And their ability to help people lose weight is really incredible. Now, everybody's body is different. So I have seen that not everybody responds in the same way. And some people lose quite a significant amount of weight very quickly. And some people lose nothing. And some people lose a good amount of weight, but very slowly. And it really does depend on the individual. But in general, studies have shown that on medications like Ozempic or Wegovy, people can lose at least 15 to 20% of their body weight, which is really unprecedented for any other weight loss medications that we've had on the market. In the old days, when we were using different types of medications like pills to help with weight loss, we might see 5% of body weight loss, maybe 10 in a patient that responds really well. So 15 to 20% body weight loss is really an incredible number. And other medications are showing even more promise. For instance, Mounjaro, tirzepatide, Zepbound, all being really the same medication, they're showing even more weight loss than that. And they seem to actually cause more weight loss than Wegovy or Ozempic do. But it's really important to note that this type of weight loss really depends on the person. Because when you use these medications as tools to help with weight loss, not just relying on them to do all of the work, When used as tools, they can be very helpful. When combined with a healthy diet, adequate protein intake, and a good exercise regimen, especially one focused on building muscle, we can see incredible results from these medications. But when used alone without those lifestyle changes, we generally do not see as great results. Now, while these medications are really incredible in terms of what they can do for your health, they also do come with some side effects. The most common side effects are those related to the GI tract. So think about it. We are slowing the amount of time it takes your stomach to empty so that you feel fuller longer, you digest food a little bit slower, less of a blood sugar spike. But what that can mean is maybe you feel a little too full, maybe you feel bloated, maybe you have some nausea, maybe it gets as extreme as vomiting. Maybe you start to develop acid reflux that you haven't had before. We can also see GI side effects kind of more downstream in the intestines. So some people get a little bit constipated because, again, you are slowing down the GI tract. Other patients can actually have the opposite effect and develop diarrhea on these medications. Now, these side effects generally are mild and generally do go away as you continue the medication. However, there are a few pretty serious, severe GI side effects that are uncommon but possible. One is that sometimes, especially if you have underlying gallbladder disease, they can worsen gallbladder disease or even cause it. So if you're on one of these medications and you start to develop pain on your right side, just under your right ribs, that might be a sign that you are having a gallbladder side effect, and that absolutely needs attention and medical treatment. Additionally, these medications may be associated with something called pancreatitis, which is inflammation of the pancreas. The pancreas is what sits kind of right under your rib cage, right near your stomach. And pancreatitis is essentially inflammation of that organ. This would feel like very severe stomach pain in the front that wraps around to your back. It can cause nausea, it can cause vomiting, it can cause diarrhea. It can be life-threatening. So if patients are on these medications and developing these side effects, we generally stop the medicine right away and have the person seek immediate medical care in the emergency room. Now, one possible side effect that has gained some press from time to time is the idea of thyroid tumors or thyroid cancers. Now, when these drugs were initially developed and studied in rats, there was an increase in a type of cancer called medullary thyroid cancer. This is a very uncommon type of thyroid cancer. It is not the most common type by any means. The most common types of thyroid cancer are papillary thyroid cancer or follicular thyroid cancer. But medullary thyroid cancer was seen as an increased risk in rat studies. Now, over time and with many years of these medications being studied, more data is coming out to suggest that these medications do not increase the risk of common thyroid cancers like papillary or follicular. However, because of what was seen in rats, we generally do not recommend these medications to people with a history of medullary thyroid cancer or even a family history of medullary thyroid cancer. Therefore, making sure that if you're going to start one of these medications or have one of these medications prescribed, you've had a thorough discussion with your doctor. Your doctor knows a very solid family history on you, and you discuss all of these potential risks. So who would be a good candidate for one of these medications? Now, in terms of official approvals and what some insurance companies cover for, or the typical patient that these are prescribed for, we do have certain guidelines. So generally, these medications, when used for weight loss, are approved for patients who have a BMI or body mass index over 30, or they're overweight with a BMI over 27 and a health-related complication like high blood pressure, high cholesterol, high blood sugars, etc. They are also approved for treatment of diabetes. even in patients who are not obese, but we certainly prefer to use them in patients who are obese and do need to lose weight. Now, while those reasons are the official approvals for these medications, we sometimes do use them in patients that fall out of this category. But one thing I would consider is the patient's overall health. So these medications are showing to have benefits beyond just weight loss. These GLP-1 medications can significantly reduce the risk of developing type 2 diabetes by actually over 90%. Now, that is an incredibly big number. If you think about how many people are possibly going to develop type 2 diabetes in the future, if you think about how many people have a strong family history of it, if you think about how many people are already struggling with pre-diabetes and blood sugar problems, this is an incredible result that you could potentially prevent the development of type 2 diabetes just by using one of these medications. They also have been shown to reduce the risk of heart attacks and stroke. So they offer exceptional cardiovascular protection as well. And there's emerging research right now that's exploring other benefits, like reducing inflammation, for improving or treating fatty liver disease, even possibly protecting against cognitive decline. And we talked about before that they may even be used in the realm of addiction medications. So when I think about these medications, I think of them as long-term medications. They are going to help lower body weight. They are going to help prevent development of certain diseases like diabetes. They are going to potentially reduce your risk of a heart attack or stroke. They might even potentially reduce your risk of developing fatty liver or cognitive decline. So they have a lot of preventative medicine characteristics. When people do start these medications, it does seem like they need them for the long term. And that's where this becomes a very important discussion with your doctor about whether you should start one of these or not. If you are a person that is already starting to develop medical conditions like high blood pressure, high cholesterol, blood sugar problems, heart disease, then you could really look at these medications as maintenance medications to prevent other medical issues in the future, and that they would be a good idea to use long term. However, if you don't quite have any of those medical problems, or maybe you're not that overweight, you're a few pounds over where you'd like, but you're not really in that overweight or obese range, you might want to really consider not starting one of these medications. The reason is because we're finding that when people use them for a short period of time and then stop them, they generally do tend to gain that weight back. There are newer studies showing that when you lose the weight on these medications, you lose mostly fat, but a little bit of muscle. Now, that's normal for just weight loss in general. Even if you were losing weight with diet and exercise, that's what would happen. You would still lose a little bit of muscle. But some studies are suggesting that when you regain weight after stopping them, you're actually only gaining fat. So if you think about it that way, you might be worse off metabolically by using this medicine for a short period and stopping it, as opposed to maybe implementing this as one of your tools for staying healthy long term, especially if you are at risk for metabolic diseases. But of course, none of us know what the long-term effects of these medications are. So they were just really discovered and came to market in the early 2000s. Yes, it's been a few decades, but we don't know what these medications do 50 years from using them. So we don't have that type of long-term data. But as physicians, a lot of us look at it as maybe we don't know in 30, 40, 50 years what this medication will do, but we do know in 30, 40, 50 years what untreated obesity will do. We know the higher risk of multiple types of cancers with being obese. We know that these medications, and by helping with weight loss, can reduce the risk of those obesity-related cancers. We know that these medications can possibly reduce the risk of heart disease, stroke, fatty liver, maybe even dementia. And so leaving those conditions untreated, we know where this is going. Therefore, a lot of us feel that while we don't have that long-term data, it is better to get your health controlled early on rather than letting all of those medical conditions develop. But this is certainly a very personal decision and a decision that should be a thorough conversation between you and your doctor about what is right for you. My ultimate opinion on these medications is for the right patient, they can be an exceptional tool to improving health. When used with a healthy diet, high protein, adequate hydration, and a regular exercise regimen, these tools can be incredibly effective for people that are struggling with metabolic disease. And they can be incredibly helpful at preventing medical problems that we know cause significant issues long-term and even early death. But they are not the right decision for everyone. So the key here is really personalized care and a conversation between you and your doctor to understand what your goals are and your unique health journey. Thank you for joining me today into this deep dive on GLP-1 medications on the Wellness Protocol. If you found this episode helpful, please subscribe or leave a review or drop your comments or questions. Your engagement and feedback really helps the podcast and helps our community grow and thrive. Don't forget to share this episode with someone you care about who might benefit from it. Until next time, stay informed, stay empowered, and keep prioritizing your wellness journey. Take care.